For adolescents, every woman or every child have the right to health facility. Being an adolescent, you need to take your time because adolescence is the moment we misuse and then we go the correct way.
Because like we say, children are the future. And if a country can't produce children, the country is not growing, then we don't know what the future will become. Because the more we have these children, the more we have new ideas, new technologies, new interventions and all. So
yeah, it is important to empower them because when you look at any country, when there are crises, they face the heavy weight of issues that they are more vulnerable. So it is important for us to empower adolescents because if we empower them, like we always say, information is power. Giving them information to understand because they are young. They are at that age that they don't have information. So giving them information, they are well informed, they know what they are, how to make decisions, informed decisions. So at the end of the day, they cannot fall short in terms of early marriage, teenage pregnancy, you name them, all the rest that we know adolescent girls face. So for me, it is key. We give them information. When we give them information, they are well equipped with information so they can make informed decisions about their own life, about their healthy lifestyle.
So always you need to make your friend with the health facility. When you be friends with health worker, you stay a healthy life.
When you think of maternal health, I really consider the puberty period to be a preconception period. And preconception health has been shown to be more and more important as we are learning about maternal health. So what the kind of health that women bring into, for example, a pregnancy is really key. And we know that women can bring in risk or protection that's going to then be transmitted to their child during pregnancy and then be transmitted to child health outcomes as well as their own health outcomes during their life course. So if one thing that we say during preconception health is women should really be adopting healthy behaviors before they even come into a pregnancy in order to have good outcomes for themselves and their child. So that means having a healthy weight, for example, not smoking, no substance misuse, eating healthy, all of that. And so physical activity is an example of a great sort of preconception health behavior that can, if people are socialized to do that before coming into pregnancy, that then sets them up for a really great trajectory, for childbearing and their longer maternal and child health.
And where do you find adolescent? You find them at school. So that is where you can address it, okay? So at schools, you can address it through physical activity. And this physical activity, we see them very rampant at schools. They have breaks where they go to the field, they are running about, they are playing football, girls are playing netball. So these things are there, and then at schools they have these things integrated into their curriculum. Things like balanced diet, where they are taught what is balanced diet, what is good nutrition, what is carbohydrate, what is protein, how much should you have.
So telling them about the diet is very, very key. Because if you don't eat a healthy diet, how can the baby grow? The baby cannot grow. It will become restricted, not to grow. And that is not what we are looking for. If we want to get a healthy mother and healthy baby, we need to counsel them about their diet, nutritional diet. And these are the ones that I've mentioned. They will be eating the beans, the potato leaf, the okra, the garden eggs. These are our natural remedy for the diet. And tell them when to eat a meal, how to change the diet, carbohydrates, and how to use vegetables. The importance of vegetable also. Tell them how to change the diet. For us here, we have vegetable, they do plant them. So it's only for them to make use of them, not to sell them all the time. It is really important to them again changing their diet. So this is the way we continue. Any visit, we tell them, we give them health talk. Any visit, we give them health talk about the importance of the diet, nutritional diet.
If they tell you their age and the way they physically look, you will be doubting, what is this? But it's because of what you eat and how you practice and how you exercise in your daily life. Also, it will prevent you from chronic diseases. If you have a good health practice as an adolescent, it will prevent you from chronic disease like heart disease, liver, and all of those illnesses. So if you if you exercise well, then you eat. I don't say because there are these simple things that we also cultivate in our country, which if you eat them, they have the minerals that we needed. But some prefer to sell those what we the harvest that we have instead of eating them, because we want the money at the end. Then we will be coming back to the hospital, which you will spend the money instead of you using those crops or those harvests that you have. You eat them, then you will not come again to the hospital to waste money and time. But we don't have those knowledge that the money that the health is more better than the money that we are going to find.
Really thinking about sort of the psychosocial benefits of physical activity. So, for example, it allows especially women, I would say, or young girls, to have increased self-esteem, better mental health, and also really increased social connectedness that they would experience in having, being in a team sport, for example. So that's really, really important for that, especially during puberty, which is such a vulnerable state, for young girls to have that. And really having that sort of like team that, during a difficult time is really important, I would say.
So it is also important for adolescent girls to work with people who they admire, like somebody who have got value, who is a role model in a society. They will look at that person and say, no, I want to be like this person. With those people, they will definitely change their lifestyle. One of the key important things for adolescents to have a healthy lifestyle is how the family taking care of their positive parenting. I can put it that way, positive parenting. How the parents are actually like taking care of the adolescents. Because if they are well taken care of, they can live a positive, healthy lifestyle. Because if they have food, they have what they need, they're supposed to have, they cannot go to the street and look for it. But if you allow the adolescent girls to go and look for something to come and feed the family, then definitely you are putting that adolescent girl at risk, and it will lead to unhealthy lifestyle.
Firstly, young girls have to understand that they have not yet fully developed. Pregnancy has a wall on its own. We've seen cases wherein there is a massive transformation, even with women that are mature. So you as a young girl, or maybe as a teenager, if you are not matured enough, if you've not fully developed enough, you don't even understand your body, you don't understand your menstrual cycle, basically you are trying to understand life for yourself. I think one of the things you should do is to focus on how to live a healthy lifestyle. Talk with your parents, maybe talk to elderly people, how to take care of yourself, how to go about your monthly cycle and all. And after that, try to live a healthy lifestyle, because especially on your menstrual cycle, you have to practice safe hygiene. You don't have to be going all over the place and you stink to an extent. So you have to know some of this before involving or maybe getting pregnant.
Before this time, menstrual cycle or menstrual situation is something that was not talked about. Even if a girl starts menstruating, she will hide and all this stuff, which is not good, because the more education you get about something, the better you are able to behave in a certain way to get good outcome of it. But girls that are going to school, most times they don't know how to change their pads or which type of sanitary pads they should use, which is good. Sometimes I can still recall in a community where we went on outreach, a girl is still using a used cloth. They fold it for a pad, which is not healthy. It can infect the person if it's not taken care of. And also, maybe because of the costs to buy sanitary pads, one person can use one pad for probably the rest of the day instead of changing it. So the educational part of this menstruation thing, I don't think it's kind of like talked about to the way I want it to be talked about, because every girl has the right, because this is an important part of the human, especially for the women, because with the menstrual cycle, if it's good, you don't have any infection, then you have the opportunity to bear children if you want to. But if because of an infection, it affects your reproductive health, then I don't think it's kind of like a good thing.
Imagine a girl missing classes, every month because she's menstruating. That's like roughly missing class for 60 days in a year. That's a lot. Like because I think in most countries in West Africa, we have more women than men, and these people contribute to a huge number of the workforce. So in a case whereby they are not being allowed to come to school because they had to stay back at home, they are not being able to get the adequate knowledge that they need, and it's also kind of causing a burden to the workforce because we need them. They are our future leaders. They have to grow up. They will become employed. They have to take up those spaces, and they have to be given the opportunity to be able to not miss the foundational years of their life. And when they have the opportunity to show up, they'll be able to show up stronger and better. Yeah.
Adolescents, education is key. Although for some people, they find it difficult. But when you educate one girl, you have almost educated a nation. Being educated, you make a difference in a society. If you are educated, you don't find things difficult. You don't find these things difficult. And poverty, you contribute in reducing poverty rates in our country, also in the community where you come from. So it's important for a girl child to be educated. Not only a girl child, the young people to become educated. Because if they're educated, they will totally make a difference.
If you are healthy, if you're a healthy person, as I said earlier, it will prevent you from many predisposing factors or illness that will happen during pregnancy, like eclampsia, anemia, and malnutrition also. If you are healthy, you eat well, you exercise well, all those conditions will prevent you from. But if you don't eat well, you'll be exposed to all of those conditions. So even if you, talking of the menstrual health and linking to that, if you do not take care of yourself during your menses, and it exposes you to infection. That infection, even when you get pregnant, it will affect you and also the baby in the long run. So if you don't take care of yourself well, or you don't manage to practice a healthy life, it will affect you, not just you, and also the future while you are pregnant or while giving birth.
So just making sure that people are being listened to and also given the attention that they deserve, being monitored carefully, right? Because that would really do a lot to sort of prevent all of these sort of maternal health emergencies that lead to maternal mortality. So I would say, in that space, it's really important that healthcare providers play a role and it's really their responsibility, I would say, to build that trust and rapport with the patient.
And you too, the health worker, you need to befriend them. At any time, they will ask you a lot of questions. And when they ask you a lot of questions, you need to answer to their question because they are so curious. They want to know. So since they want to know, your own responsibility is to give them the information they need. Because you are serving as a counselor, guidance counselor. So you need to counsel them. When you counsel them, they will follow the right route. But if your own responsibility, you fail your responsibility without giving them the correct information they need, that is the area we are going to lose them. And if they get unwanted pregnancy, we know teenagers, they are not due for pregnancy, we know the outcome. It might be obstructed labor, fistula may come in, and even maternal death. And that is not what we are looking for. All we are looking out for is to get a healthy mother and a healthy baby. So if you want to achieve that, you need to take up your responsibility as a healthcare worker, guide them, be by them, counsel them, direct them to follow the right road.